7 statin interactions you need to know. Statins are among the most widely prescribed medications in the United States, commonly used to lower cholesterol and reduce the risk of heart attack and stroke. Popular options include atorvastatin Lipitor, rosuvastatin Crestor, and simvastatin Zocor Flow-Lipid. Because statins are so frequently prescribed, it's essential to understand how they may interact with other medications you take. While individual statins have unique characteristics, there are several interactions that apply to many, if not all, of them. Below is an overview of 7 important statin interactions and why they matter. 1. Fibrates. Fibrates are a class of medications used to treat high cholesterol and elevated triglycerides. Examples include fenofibrate, Tricor, and gemfibrozil, Lopid. Both statins and fibrates carry a risk of muscle pain and, in rare cases, serious muscle damage known as rhabdomyolysis. This condition occurs when muscle tissue breaks down and releases proteins into the bloodstream, potentially leading to kidney failure. Taking a statin and a fibrate together increases this risk. When combination therapy is necessary, fenofibrate is generally preferred over gemfibrozil, as gemfibrozil has a significantly higher risk of causing muscle-related side effects. In situations where gemfibrozil must be used, healthcare providers may recommend lowering the statin dose to help minimize complications. If you're taking both a statin and a fibrate, inform your healthcare provider immediately if you notice symptoms, such as severe muscle pain, weakness, or dark, cola-colored urine. These may be signs of rhabdomyolysis and require urgent medical evaluation. 2. Transplant medications. Organ transplant medications help prevent your body from rejecting a new organ. Common examples include cyclosporin Sandimmune, tacrolimus Prograf, and sirolimus Rapamune. Cyclosporin and tacrolimus can slow the breakdown of statins in the body, raising statin levels and increasing the risk of side effects such as muscle pain and rhabdomyolysis. Sirolimus and everolimus, Afinitor, may have similar effects. Although all statins have the potential to interact with transplant medications, certain combinations are riskier. For instance, you may be able to take rosuvastatin or pravastatin with cyclosporin, but only at reduced doses. In some cases, the combination may need to be avoided entirely. Always provide your healthcare provider with an updated list of all medications you are taking. If needed, they can adjust your statin dose or choose a statin with a lower risk of interactions. 3. Colchicine. Colchicine, Calcres, Lodoco, is an anti-inflammatory medication commonly used to treat gout flares and, in certain cases, to lower the risk of heart attack and stroke. Colchicine can cause muscle pain and, in rare cases, rhabdomyolysis. When combined with a statin, the risk of muscle-related side effects can increase. In many cases, you may not need to avoid this combination, but your healthcare provider will likely monitor you closely. A lower statin dose may be recommended, and you should promptly report any new or worsening muscle pain. 4. HIV medications. Many HIV medications can interact with statins because they affect how drugs are metabolized in the body. Examples include atazanavir Reatas, darunavir Persista, and ritonavir Norvir. Levastatin and simvastatin are most likely to cause serious interactions and are often avoided with HIV treatments. Pravastatin and rosuvastatin tend to have a lower interaction risk, but dosage adjustments may still be necessary. Because HIV medications are often combined into single pills, it's important to keep your HIV specialist informed about all your prescriptions. They can choose the safest statin and dose it for your situation. 5. Warfarin. Warfarin, Coumadin, Januvin, is a blood thinner used to prevent and treat blood clots. Certain statins can increase the effects of warfarin, raising the risk of bleeding. If you take both medications, your healthcare provider may schedule more frequent blood tests to ensure your warfarin dosage remains safe and effective, especially when you start, stop, or change your statin dose. Report any unusual bleeding, easy bruising, or blood in your stool or urine immediately. 6. Paxlovid. Paxlovid, nirmatrelvir/ritonavir, is prescribed to treat certain COVID-19 cases. Like some HIV medications, it contains ritonavir, which slows drug breakdown in the body. This interaction can cause statin levels to rise, increasing the risk of muscle pain and rhabdomyolysis. Pitavastatin and pravastatin can generally be taken safely with Paxlovid, but atorvastatin and rosuvastatin may need to be paused during treatment. Levastatin and simvastatin have stricter guidelines. They should be stopped at least 12 hours before starting Paxlovid, held throughout the 5-day course, and avoided for at least 5 days after finishing treatment. If you're prescribed Paxlovid, do not stop your statin without medical guidance. Your provider can determine whether to adjust your dosage, switch to a different statin, or temporarily stop therapy. 7. Alcohol. If you take a statin, it's best to avoid or limit alcohol. Heavy or long-term alcohol use can damage the liver, and while rare, statins can also cause liver injury. Combining the two may increase this risk. Additionally, alcohol can raise cholesterol levels and contribute to heart disease, potentially reducing the benefits of your statin therapy. Moderate alcohol consumption may be acceptable for some people, but it's important to check with your healthcare provider about what's safe for you. Be honest about your alcohol intake, as your provider may recommend additional monitoring or lifestyle adjustments. When to contact your healthcare provider about statin interactions, always keep your healthcare provider and pharmacist updated on all medications and supplements you take. This allows them to identify and prevent possible interactions before they cause problems. Most statin interactions increase the risk of muscle-related side effects, including muscle pain and weakness. If these symptoms appear, let your provider know promptly. They can determine whether an interaction is to blame and make any necessary adjustments. Seek immediate medical attention if you develop severe muscle pain, weakness, or dark, cola-colored urine. These are hallmark signs of rhabdomyolysis, a rare but serious condition that can lead to kidney damage if not treated quickly. The bottom line: key statin interactions include fibrates, transplant medications, colchicine, HIV medications, warfarin, and Paxlovid. Alcohol should also be used with caution due to its potential effects on the liver and cholesterol levels. Before starting a statin, talk with your healthcare provider and pharmacist to review your full medication list. In some cases, you may need a lower dose or a different statin to minimize risks while still getting the cardiovascular benefits. Stay informed. Stay healthy. For more trusted science-backed health information, subscribe to the HeInfo channel, your reliable resource for clear, expert-driven insights on medications, wellness, and healthy living. Turn on notifications so you never miss important updates that can help protect your health.